Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about prior authorizations and what payers are promising to change. I had a comment from a viewer this week, and she is quite frustrated with the lag time it's taking for insurances to provide prior authorization responses, not just approvals, but responses in general for her patients because they're in physical therapy. And it's very frustrating. This is a growing frustration across the country. This isn't anything new. It seems like it's just getting worse. So I was like, you know what, let's do a video on this, because then I came across, ironically, an article on Becker's that I received about some of the pledges that payers are making when it comes to the prior authorization process. So I went in and I did a little bit of research about kind of what the burden is right now for obtaining prior authorizations in a provider clinic, in a medical clinic. And I was, not shocked, but not happy, I guess I would say, because it used to be this way a long time ago when I got into healthcare, and then we kind of went away from requiring prior authorizations and referrals, and we seem like we've come back in full force and then some. So how bad is it, right? How bad is it right now, the temperature in healthcare when it comes to prior auths? Well, I don't know what the study was taken from, and I'm sorry I don't have the background on the statistics. However, it says on average 39 prior authorizations are required per physician per week. 39 per physician per week. So you do the math depending on how many providers, physicians you have in your office, okay? And on average, 13 hours per week is wasted by staff submitting and working on prior authorizations. 13 hours. We only have 40 hours in a work week. That's almost half. 40% of practices have full-time prior authorization staff. That's all they do all day long is submit prior authorizations, track the status of prior authorizations, and respond to whatever response they received from the insurance company. 89 to 93% of practices that were interviewed say it delays care, which how could it not, right? 29% report serious adverse outcomes because of the delay, not acceptable. And it's one of the highest reasons for burnout from staff, hospitalizations of patients, and even deaths are linked to the delays of the authorizations being not timely. So this is terrible. They talk about our healthcare system and where can we improve and yada, yada, yada. This is a huge thing right now. And I know that it's a topic of conversation. I know it's been discussed and we'll get to that. But these numbers are alarming, okay? But I'm not done. So what are the hidden costs, right? Let's get down to the nitty-gritty finances when it comes to all of this. Well, 80% say that patients pay out of pocket when they're delayed. They just say, oh, well, I need this, whether it's a medication, imaging, to see a specialist, whatever it is. They go, you know what? I don't want to wait anymore. I'm miserable, or I don't feel good, or I don't want to get worse, and I'm just going to pay out of pocket. When we already pay a ton of money out of pocket for premiums, deductibles, coinsurance, and I know you know this. 88% say delays lead to more ER visits and complications. Well, of course, how could they not? If they're not getting the treatment and the care that they need because they're waiting on a prior authorization and they're just getting worse, of course it's going to increase hospitalizations and cost the insurance company more, right? Because if they would have just approved this high cost whatever's being asked to try to find the root cause or to fix whatever's going on, then they wouldn't have to put out this money for a hospitalization or an ER visit. But whatever. And over 60% of providers suspect that the AI tools that are now being used are denying care automatically. Like there's something in the algorithms or whatever's being reviewed in prior auths, and they feel like they're getting more denials of prior authorizations with the use of AI than they were before. So obviously there's a big elephant in the room, but it sounds like they're starting to really recognize this, and it's been a hot topic of conversation for a while, and I think it's kind of starting to reach its peak. So there's been a discussion with healthcare companies, like, what are you going to do about this, right? Can insurances compromise? Can they try to help fix this? And the industry goal right now is that 80% of prior auths processed in real time by 2027. So the insurance or whomever has tried to set the standard and say, look, this is unacceptable. We need authorizations to be determined in real time and not a week delay or longer. So what are we going to do about it? How are we going to do this? And the insurances say, you know what, by 2027, and I don't know if that's the beginning of 2027, the middle of 2027, or the end, but right now it's 2027. Their goal in the industry is that 80% of prior auths will be processed in real time. Now, what their definition of real time is, I don't know. I'm hoping it's within 24 hours of submission, but we'll see. They want to have a unified electronic submission standard, and they say it's in development. I really, really hope so, because that's one of the most broken areas in healthcare right now, is that every insurance has a different authorization process or referral request process when it comes to medications versus imaging versus seeing specialists, and it's hard to keep up with. And if you're missing anything, they deny it and they send it back, which delays. But if you're not used to what they're asking for or whatever, it's going to make you more likely to have errors, right? So it needs to be standardized. So this is music to my ears. Fingers crossed it gets done sooner than later. They want a 90-day prior authorization grace period when patients are switching insurances. So if a patient goes from one insurance to another, there would be like a 90-day window where they wouldn't need prior authorizations, because I'm guessing the assumption is there's some kind of continuity of care that they were receiving that didn't require a prior auth, or they already had a prior auth on file, but then they switch insurances and they don't want to have to reinvent the wheel again and delay whatever progress that they were making, which I think is great, especially when it comes to medications, right? So that's a good goal. It's a good goal. They want to reduce services requiring prior authorizations, which according to United Healthcare and some other insurances, they have said over the last few years they have decreased the number of services that require the authorizations. But honestly, I haven't seen that. I don't know where they did that. And I don't think a lot of medical offices would say they've seen that either or felt that decrease. But apparently they have. So hopefully this will be even better and it will actually be felt, the decreasing. They want to do real-time integration with EHRs. That, again, would be wonderful. If they could standardize what needs to be submitted with authorizations and the application or the documentation, and it can integrate with EMRs, game changer. Be huge. It would be fantastic. And they also want to include what the exact clear reason was if a prior authorization is denied. Instead of being ambiguous and just saying denied because it's not supported, medically supported or something like that, they want to actually try to provide more specific information for that patient, why it was denied and what was provided. So it will help medical professionals be able to get what is required or prevent sending suboptimal information the first time to try to get it past the first time. We will see if this happens, but honestly, I really, really think that because it's become such a huge known burden on medical practices, something's going to be done. Apparently, there's some CMS and legislation going on because there was a rule in 2024 set by CMS that said that there had to be a 72-hour turnaround for urgent requests. 72 hours. In my opinion, that doesn't seem urgent. But again, I don't know what I'm talking about sometimes, I guess. They implemented a 7-day standard decision timeline. Like I said, right now, it's averaging about 7 days to get those PA results or determinations. And they had to do public reporting of prior authorization metrics. It's definitely a step in the right direction, and I can see how these next goals are kind of stepping off of that, so that's good. There is some bipartisan bills that are pushing for an electronic prior authorization across Medicare Advantage plans, because I know Medicare Advantage plans do tend to require a lot of authorizations for the HMO plans, and that bogs down a lot of clinics. And a lot of patients will just end up dropping Medicare Advantage and go to Medicare because Medicare doesn't require authorizations. So I think they're seeing that, and that's why they have some bills pushing for this. They have a gold carding of providers. Not sure what that is. They want to provide the clear denial reasons, which is huge. And they want human oversight of AI usage, which I agree. I don't know why that even has to be said, to be honest with you. I think AI is going to be wonderful. But again, it's not to replace people. It's to supplement, and humans should still always have an eye on it. So let's hope for the best, but expect, what we can. I would say that there haven't been a lot of felt changes with that 2024 implementation. According to the statistics too that I was provided, it says only 16% of providers say they felt real changes. And many say that burden is still just as high, which I agree. And the gold carding is still rare, which I honestly don't even know what that is. I should look that up. And the AI-driven denials is raising red flags because they're seeing an increase in the denials, which I'm not shocked. But yeah, we need to be active for our field. We need to get our senators and representatives involved. We need to be telling them how big of a burden this is. If you haven't been involved with this kind of thing and advocating for your field, now is the time. This is a perfect one to start with, is the authorizations, because no matter what specialty you're in, you are affected somehow. And it's just gotten worse, and we need to advocate for ourselves, but we also need to advocate because of our patients, right? And that's the number one thing, is that our patients are getting the care they deserve and the care that they expect. So we need to advocate for them while we're advocating for ourselves. If you have any questions or comments about this, please leave that in the comments below. Again, as I get updates, if things change or I'm noticing anything improving, I will let you guys know, I promise. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with your colleagues whom you would like to get involved with advocating for our healthcare system, specifically prior authorizations. I appreciate your support, and we will see you next time. Bye-bye.